Welcome to The Backstory with Dr. Ricky Singh. This podcast is focused on bringing you the latest research-based information about dramatically improving health, well-being, and quality of life. And here's your host, Dr. Ricky Singh.
Welcome to The Backstory. And in today's episode, I'm going to talk to you about sleep, and specifically back pain and sleep. You know, I get a lot of questions from patients and even family members about mattresses. You know, what's the best mattress I should get to maximize my restfulness? And we're going to explore that today and see what the science shows about mattresses and how to optimize your sleep health. So as humans, we spend about a third of our lifetime sleeping. And in the past couple of years, a lot of patients and a lot of people are reporting sleep disorders. And if you don't get restful sleep, you're not going to be ready to go and function and live the fullest life possible. Optimal sleep duration is between 7 and 8 hours per day. And with the changing work environment, the fact that we've just been through a 2.5-year pandemic, changes in lifestyle, we know that there has been a reduction in sleep hours. And more importantly, there's been a reduction in sleep quality, which no question has negative impacts on everyone's quality of life and their health, and also mood. You know, there's a saying called getting up or waking up on the wrong side of the bed. And basically what that idiom is suggesting is that you're starting the day feeling tired or unhappy or achy or grumpy. Whereas if you wake up rested, you tend to feel happier, you're ready to tackle the day, and you definitely got up on the right side of the bed. Some may argue, myself included, that on Mondays there's probably no right side of the bed because starting the week is not always easy. Anyone who lives with back pain certainly understands a huge difference a restful night's sleep can provide. And on the flip side of that, how disruptive it is when you wake up and you already are experiencing discomfort. And there's many causes of back pain. You know, I try to stress what it is we do when we're not sleeping that prevents back pain, but there is a role in the mattress you use, the pillows you use, and the posture in which you sleep that can affect your overall spine health. A significant number of people that I see in the clinic lack appropriate sleep for several reasons. And we've talked a little bit about sleep habits in the past, whether they're drinking caffeine too late at night or watching TV or scrolling on their devices through social media. But back pain has also been identified as a possible cause for inappropriate sleep, especially in adults. And previously, if you've seen your physician, oftentimes the quality of our mattress or the bedding system has been discussed. And there is controversy in the literature regarding the type and the characteristic of the mattresses. And most people used to get the standard recommendation of sleeping on a firm mattress or sleep on the floor. You know, if you have something that's as solid as a plank, you're going to get more support for your spine and decrease your spinal pain. But contrary to popular belief, in order to treat an aching back, you don't really need a firm as a plank mattress. In fact, there is no specific mattress that's best for back pain. And to think about this, if you have an overly firm mattress, you might get more tension and stress because it won't contour or conform to your body shape. Even if you put one of those pillow top or mattress toppers for extra comfort, you still have a little stress on those pressure points. On the other hand, a soft mattress can be too saggy, and it may not provide the necessary support for proper spinal alignment. If you're someone with wider hips, for instance, you might find benefit from a slightly softer mattress, and the reason for that is because the mattress will give in order to maintain your spinal alignment. On the other hand, someone with narrow hips or a smaller frame might be better off with a firmer surface. A study published in Sleep Health looked at 40 studies between 2000 and 2019. And overall, the results of this large systematic review showed that if a mattress is subjectively identified as a medium firm mattress, that is what is optimal for promoting sleep, comfort, quality, and spinal alignment. So let's talk a little bit about what that means, medium firm mattress. So there's two parts of this, medium and firm. So the medium part of medium firm not only release pressure points, as I mentioned earlier, but it also cushions the heavier parts of your body in a supportive way without letting them sink too far into the mattress. And we really have to talk about how you sleep in order to illustrate this better. So if you're a back sleeper or someone who sleeps on their spine or their back, your shoulders and hips can settle into a medium firm mattress, just enough so that your lower back or your lumbar spine is supported and remains concave. kind of arched. On the other hand, if you are a stomach sleeper or you like to sleep on your belly is going to be more cushioned with a medium mattress, and your spine and lower back will feel supported, not allowing your lower back to go into the shape of a hammock. And finally, if you're a side sleeper, a medium firm mattress is going to cushion your shoulders, your hips, and knees in order to maintain spine alignment so it's not twisting or bending in a funny different way. The second part of medium firm is the firm part, and this is what keeps your spine aligned. Again, if we were to think about those three different positions of sleep, on your back, on your stomach, or on your side, your body should be roughly straight or in neutral alignment. So that for back and stomach sleepers, you should be able to draw a line from your neck down towards your lower back into your knees. And if you're a side sleeper, you should be able to draw a line from the midpoints of your ears, your shoulders, and your hips. And that's how you know that the mattress is supporting you appropriately. Now, a lot of us out there have had mattresses for many years. The first question I ask a patient when they talk about mattresses is, how long have you had your mattress? And I know you've been through a lot with your mattress. They've been cozy times and they've probably been sleepless nights. But like anything else in life, sometimes this relationship was not meant to last forever. And we know from looking at various studies that mattresses tend to last between 8 and 10 years. So if you're listening to this episode and your mattress has not been replaced for 15 or 20 years, maybe it's time to consider it. And what are some of the ways in which you can identify if your mattress is too old? And some mattresses will show signs of wear and tear. You'll have a harder time getting comfortable. The mattress might sag in places. It might start to squeak. You might even see some of those coils poking through the surface. If that's you, it's probably time to replace your mattress. But one of the best indicators that it's time to replace your mattress is if you wake up feeling sore and stiff. Back pain in the morning can be from improper support from your mattress or inflammation that is accumulating while sleeping. And a good and supportive mattress will allow you to get a restful sleep and recover so you wake up ready to tackle the day. Another sign that your mattress is ready to be replaced is temperature. And we know that a comfortable temperature is important to getting good night's sleep. If you're one of those people who throw the covers off during the night, it might not just be your room temperature, it might actually be your mattress. Memory foam mattresses are notorious for sleeping hot. And the reason for that is because the foam softens in response to your body heat that helps contour to your body. And some patients and some people might like that. There are newer technologies that have come out, such as the cooling gel layers within the memory foam mattresses and more breathable fabrics. And these can often offset these variations in temperature that may not allow you to get a restful sleep. It may not be the mattress, however. It might be you. Your body type has changed. You might have been 160 pounds and now you might be 200 plus pounds. And if you are in that group of 200 and 250 pounds, the most important things are support, durability, and sleeping cool. In addition to pressure relief, a supportive mattress, perhaps with memory foam, will provide you with significant and sufficient support along with maximum airflow to allow you to rest and recover while you're sleeping. So it's confusing. Where do you go from here? Nowadays, most mattresses are sold online. Those days of walking to a Sleepy's or Mattress King are getting less and less. But the good news is a lot of these online mattress companies are offering trials. Whether you're thinking of a Casper mattress, which is what I use, or Purple, or Leaf, or this newer company called Sattva, many of them are offering 90 or 100 days, or even 180 days of an in-house trial. And why that's helpful is that by trying this mattress for a long period of time, you'll work through your different body positions, you'll figure out what mattresses work the best for you, and then you can send them back to the company if you don't like them. The bottom line is that the best mattress for back pain has just the right amount of firmness, has the right amount of support that allows you to equally distribute the pressure over your body and allow your spine to maintain its natural curvature. And remember, the key word here is you. Firmness is highly subjective. Based on that study that I cited earlier, it was mattresses that were self-identified as medium firm that were shown to provide optimal sleep quality. And the last thing I want to touch on is pillows. Many patients experience neck pain as a result of everyday stresses, such as work. You're sitting on a computer. It might not be ergonomically set up for you. You're hunched over. Your shoulders are forward. You're texting and typing. Sitting at a desk for a long period of time can also add additional strain to your neck. But a person's sleep posture is also important. And one of the functions of a pillow is to keep the neck in correct alignment along with the rest of the spine that I already mentioned. And most people sleep on their sides, but some patients do prefer to sleep on their back or on their stomach. So it's important to pick the right pillow for your body position and sleep position. So in general, if you're a side sleeper, try to get a thicker pillow that supports your neck and keeps it completely aligned with the rest of your spine. If you're a back sleeper, maybe consider getting a medium pillow that allows the head to rest, but is not too many pillows where your neck is in a flex position where your chin is getting closer to your chest. And if you're a stomach sleeper, maybe consider having a very thin pillow to prevent neck extension. Again, all these things are important to maintain proper alignment of your spine. Every sleeper is going to benefit from a different type of pillow, from a different type of mattress, but the most important thing is to relieve pressure points, whether it's your hips, knees, and shoulders, and to provide support to the spine to maintain a neutral alignment. Whether it's a pillow or a mattress, these will not take the place of living an active and healthy lifestyle, working on posture throughout the day, because it's also what you do throughout the day that's going to affect your quality of sleep. So thank you for tuning in to the Backstory Podcast. Keep moving throughout the day and sleeping well at night. And when it comes to your health and wellness, we've got your back. Thank you, everyone.
Thanks for listening to The Backstory. Please subscribe, rate the podcast, and review The Backstory on Apple Podcast, Spotify, and Google Play Music. And feel free to share this podcast on social media or even your own website or blog. This podcast is for general information purposes only. It does not constitute the practice of medicine, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information is at the user's own risk. The content of this podcast is not intended to be a substitute for medical advice. To learn more about Dr. Singh and his clinical research, please follow him on social media. You can also sign up for his newsletter by going to www.rickysinghmd.com. That's RICKYSINGHMD.com.